Okay, welcome back, everyone. So now it's time for our Q&A session with our experts, Dr. Lei and Dr. Valada, Dr. Min Shim, and I. So we do have some questions in the chat. Rest assured, we will go through them in order. I think Dr. Valada might have briefly gotten to them already, but we can still go through them just to be more thorough. And some of these questions I'll read out are also questions from our previous event that were very salient to the points that we're bringing up, so we can repeat them as well. So first of all, first question, what are the contributing factors for lung cancer being the primary cancer in Asian Americans? And I think this one, Dr. Lei, I think if you can go in more depth and answer them.
I think so. I think the question there that we're asking here is the first one. Is there some kind of genetic predisposition? Is that what the question was, Lynn? Like
Yeah,
EGFR
so
mutation is something that has been seen in Asians. That's one of the mutations, and there's still a lot of research to be done to see if there are others. But there clearly is a mutation that many Asians have that are more frequent in Asians than in others, which would explain why the incidence of non like lung cancer in non-smoking women is higher than when compared to say like a Hispanic or Caucasian population.
Great, thank you. And then our second question is, what are the steps in lung cancer screening? I know we went over it in our video, but we want to reemphasize this. Dr. Valada, would you be able to talk about this?
Yeah, so it just depends. I saw that question. Actually, I'll let Peter talk about it because there is a little bit of a process about how to get to lung cancer screening. So go ahead, Peter.
Sure. So I'm going to let's take a step back. And so the question was this: say I'm going to presume that someone has had their so we can start off with the CT scan. So that's, I guess, the first step. And if the first step of the CT scan shows nothing, then we just keep screening yearly. Okay. But if there is an abnormality that then gets diagnosed with a biopsy, then the question is how far has the cancer traveled from the original site, or is it invading to other places? So that's where staging comes in, and it's we're trying to see the extent of the cancer, and there are other procedures and other types of imaging that we can do. One of the most common ones is something called a PET CT, where people are given radioactive sugar, and the idea is that the sugar is fuel, and so cells that eat more food than others will light up and eat more of that radioactive sugar, and so they can do the scan and see where the radioactivity goes, and it can give you a hint as to where there's more activity. And it's the idea is it's possible that these areas that light up are cancer, so it gives us physicians an idea where else to look. There are also other screening imaging, like an MRI of the brain, and endobronchial ultrasound of lymph nodes, looking for how far it's spread. So staging in general is trying to figure out how far it's gone. And these are the different tools that we have. This the PET scan, the ultrasound with biopsy, and more imaging.
Thank you.
okay, next question. My mother-in-law never had a cough. What other signs are there for lung cancer other than a cough if we haven't taken the CT scan? So I can talk a little bit about this, and feel free to jump in, Dr. Valada or Dr. Lei, if you have anything to add. So when I see patients in our clinic, in the primary care clinic, signs of cancer in general. So if your mother-in-law never had a cough, we would ask about abnormal weight loss, unwanted weight loss, other what we call constitutional signs, such as fevers and chills. If in the case of lung cancer, we can even ask about chest pain, shortness of breath. So what we call red flag signs, signs that signify that there could be something else more insidious that's going on. So those are all other signs that we look for as well. We can also do labs and other studies and things like that. Those are some things that we can start with prior to considering a CT scan.
Great. Thank you, Lynn. A next question is, what about non or never smoking Asian males? Can you tell us more about the information and data regarding this population?
So no, it's a good question. So they're actually, yes, Asian men are at higher risk than white men, Hispanic men, and Black men in terms of non-smoking for getting lung cancer. It's just not as significantly at risk as as women. Women are 4 to 5 times more likely than other ethnicities as a non-smoker to get lung cancer. But when you look at men, non-smokers, yes, Asian men, non-smokers do have a higher risk than their male counterparts of other race and ethnicities. So yes, men can get this too. We just see it a lot less, but we do see it. And so it is something, you're right, that we don't talk about as much that we should, but we did see that in our data from Northern California. We did see men had a slightly higher risk as well. It's just not as significant as women.
Okay, thank you for answering that question. Next, what causes lung cancer risk other than smoking? I learned that some of my friends who are female and never smoke develop lung cancer. So I think that question can go to either Dr. Lay or Dr. Vallada. Feel free to jump in.
Yeah, so I put that on the chat, and this is one of the studies that I'm doing with UCSF, and I think probably many people know on the call know about it. They probably heard from me. It's a FAN study, female Asian never smoker study, and you have to essentially, if you're a female on the call that is any Asian ethnicity, whether you're Indian or Filipino or Chinese or Japanese, and age from 21 to 90, and you have a diagnosis of lung cancer within the last year and a half, that's what we're trying to find out. We're trying to figure out, what else is it besides what Dr. Lay had said about EGFR. We know EGFR is in about 60 to 70% of Asian women that get lung cancer, but that's obviously not the full story. And so part of this study is to look, is where did you live? What part of China or Vietnam were you born in, or were you born here? Right? We don't really know, right? We don't know. Certainly there are Asian women here that are born here in the United States that are 35 and 40 that may be on this call that have lung cancer, and they never, lived in a different Asian country at all. So we're looking at that, cooking, history of TB, history of lung disease, inflammatory diseases. We're also seeing some of that. And then also a history. The newest thing that I've kind of been looking at is the history of breast cancer. That's been shown before to be a risk factor, but we're seeing a higher amount in women that have had a past breast cancer too. So it's multifactorial, but that is what we're trying to look at. And that is the holy grail of figuring that out. But I would say first and foremost, those are, if anybody is on the call, the hardest part that I've had in dealing with over the last year or so with figuring more things out is that we've really struggled, and this is a learning environment for me too. We've really struggled to get patients to enroll. We've been trying for 2 years now to get 600 patients, and we have 200 out of 600 enrolled. And so I try anything we can to raise awareness, or if you have a family member, know, because that's what we need to know. These are the questions that you all have, but we just need to look at that further by looking at you all to see kind of where you all come from, and kind of what environment you had been associated with, what kind of car you drive. I mean, it's very basic, but it's about a 30-minute online survey that you do, and you get a gift card. You get a $50 gift card, I think from Amazon or Target or something. And then there's a couple other things that we do. We could talk offline about that. I put that in the chat, but essentially that's something that I would love answered as well.
That's great. Thank you. And then this is a really great next question. Has secondhand smoke been examined as a cause of lung cancer?
So it's an associated risk factor. It does increase your risk of lung cancer, but smoking increases your risk anywhere from 8 to 20 times the risk of lung cancer, whereas secondhand smoke is more like 1.75 to 2 times the risk. So yeah, secondhand smoke is a risk factor over some amount of time, but it's not as It's not something exponential or something that is easily measured. But there have been studies to show that yes, if you have secondhand smoke consistently, maybe by your partner, your spouse, your significant other for 30, 40 years, yes, you will have a higher risk than somebody that has a spouse that has never smoked in their life. We know that, but again, it's a smaller risk factor. And so it's not the whole risk. Certainly we think that goes into maybe part of the risk, but again, if I were to be blunt, it's a smaller risk factor than say family history or a history of TB or cooking with coal or cooking with a wok with no ventilation, things like that. We know those are much higher risk factors, and radon, things like that.
Thank you. So next question. And this is, I think, a hot topic. We talk about this very often in the primary care setting. Why isn't lung cancer screening a routine procedure, similar to a colonoscopy or a mammogram?
This is a tricky one. I think that I would say that is why Dr. Velada's research is so important, because I think that the theme of what we've been talking about is that we can see that there is a trend in our ethnicity, and we're trying to figure that out. Until we can prove it, can we get the government and all of the governing bodies to say yes, this should be done? Well, that's why we need Dr. Velada's research to prove this. I think that's the best way to say it. A lot of these questions that we're getting through here is like, oh, how can I get the screening if I don't have the smoking history and things like that? That's the smoking history is what the screening program was designed for all of the United States, right? And what we're talking about is specifically today talking about Asians, and so it's kind of a subgroup, right? But we are trying to just get awareness out that there is something more to it than smoking, especially amongst us. But that is why Dr. Velada's research is so important.
Thank you. And I know this question also was answered previously, but what kind of appointment at Kaiser do we need to request for lung cancer screening? Can it be done through telephone, video, office, email? Do I request through my PCP? So I can start answering this question, and Dr. Lei, please feel free to chime in. So yes, you can first talk to your primary care doctor. And again, as we discussed, if you have a history of smoking, we can put in the referral for you. In our video, we discussed that you would first need to enroll in a class. And I wonder, Dr. Lei, is this class always in person, or can it be done through other measures?
Yeah, the class now is done in person or by video, and even by phone in patients who are not video savvy or tech savvy, then I can go over it with you over the phone, because the main idea with the class is there are certain slides that we have on a PowerPoint, but I can just describe them to you about the statistics of why lung cancer screening exists. And it's not even as in depth as our talk today, but that is completely available, and I think so. You've brought up, the question was like 2 or 3 part. It was like, how do I get it done? So you can ask your primary, you can ask any of your healthcare providers to kind of guide you into that. Your primary care doctors know how to do it. They've been trained on how to do this. So there's a quick referral within our computer system. And was there another part, like if you don't qualify, can you get a CT scan? I think that a few people have asked something of that along those lines. And that's a tricky one, because the program that we're talking about for lung cancer screening, then all of that data is collected and it's analyzed. So if you don't fit into the category of having smoked, then you're not going to qualify for the CT scan through that program. You can always get a CT scan, outside of the program. It's just that the program, it's free, it's everything's streamlined for you to get it done. But if you don't fit any of these criteria and you don't have any symptoms at all and you're just kind of scared, that's a tricky one. because I can imagine, after watching this video, you're like, oh my gosh, do I have lung cancer? Because I don't have any symptoms, but a lot of people didn't have symptoms. And so that's a tricky one. But, I've never refused a CT scan for anyone. So if in my patients, and this is just my practice, in my patients, if there's an Asian who wants a CT scan because it's really bothering them to not get a scan, then I would order the scan outside of the screening program, at least to help them. And then after one, we can keep talking about it, whether or not how often you want to repeat screening. But that is outside of the program and kind of outside of these recommendations. But you guys pay a lot of money for insurance, and you get to, you should be able to get what you want. And especially if it's bothering you and keeping you up at night, then we should talk.
Thank you, Dr. Lee.
Next question. My sister has lung cancer. Will that put me at higher risk and qualify for scanning? So this question is asking about family history of lung cancer, and does that qualify them for scanning?
I can jump in, Jeff. So the family history does not qualify you for the lung cancer screening program. It doesn't. If you had questions about what your risk is or what your increase in risk is, then I can show you what we use for our patients who have the question of whether or not they should be screened. There's a website, I'll put it in here and you can click on it. It's called Should I Screen? And it was made by the University of Michigan. And there are, I think, 9 questions that you can answer. And you put your information in, and then it'll spit out your risk of lung cancer. And what oftentimes you can do is you can put no family history of lung cancer and then have it spit out a number, and then say, yes, family history of lung cancer, and then have it spit out a number. And then you can see specifically for you how that changes things. So it's kind of a fun tool to play with. And I'll put it in the chat, but you can literally just Google "should I screen," but I'll put it in. Okay.
Thank you. The next question. I'm an Asian female, don't smoke, and I have asthma, which is usually well controlled. When I stop the inhalers, my coughing and wheezing returns. Would this be grounds for lung cancer screening, or do I wait for other symptoms? I think we've kind of discussed this several times. So, I mean, as Dr. Lay mentioned, if you are concerned and it is keeping you up at night and you really can't, you're really interested in a CT scan, definitely making an appointment with your primary care doctor is a really great first step. I don't think that just because you have asthma and you stop inhalers and your symptoms are worse, that by itself doesn't mean that there's something else going on. But again, this is a really great question. And I think, absolutely okay to make an appointment with your primary care doctor to further discuss.
Right. And what they'll often do too, it's not even if you don't want to get the CT scan, kind of one of the things I say at a minimum, at least an X-ray. And, most primary care docs, like Human and Lynn and my wife's primary care here and Dr. Tran, yes, getting a CT scan is a little more extensive. You got to wait, you got to get, it's a more involved test, but an X-ray, it's like our bread and butter for everything, not just thoracic surgery or lung health, or, it's for everything. So, if you're concerned, what I kind of say, if you're getting a little pushback about a CT scan here and there, because, you're not seeing Dr. Lay, who's a pulmonary specialist in this field, Asian American, that may be more open to that, just like I am. Right? Because you may be in the community, you may be, or even in Kaiser in Antioch, where they don't know per se, they may not see a big Asian population, or maybe they do. All I'm saying is that the Bay Area is a very diverse place, and it's not like everywhere everybody understands this. So if you have symptoms, your inhaler, blah, 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 but it keeps going on, I think, and we talked about, you saw in the video that 4-week thing, that's just something that Peter and I really go by, but it's not universal. But to me, if you're having those symptoms still, and at least a little mini X-ray, because an X-ray may not pick up a little shadow or a little something small, but it'll pick up something big and something pretty obvious. And certainly, Dr. Lay and I have seen, what we run a nodule program, that we see plenty of ones that started off with an X-ray and they saw a shadow, and then guess what they get next? Then you get the CT scan, and then you see what Dr. Lay was talking about, a PET scan and biopsy or whatever. But yeah, it often will start with just an X-ray. And so most primary care doctors or advanced practice providers or anything, they're not going to deny you an x-ray. Yes, if you just come and say I want an x-ray, that's kind of a little bit off, but you have certainly in your situation with the asthma and everything, to get an x-ray I think is totally reasonable, and I've never heard anybody get turned down from that, at least in my experience.
Great, thank you.
This next question also has some ties in with what Dr. Vallada has just said. I am an Asian male. I have never smoked and do not have a cough. I assume that I don't need to advocate for lung cancer screening unless I have a persistent cough. Is that true? Yes, so the first step to start, I can take this one, is to discuss with your primary care doctor about this cough and pursue other causes such as this cough, gastric reflux, asthma, or anything like that. And then first steps that we can do is, like Dr. Vallada mentioned, get an x-ray. So we can start there, and that's where you can advocate for screening, and that's the first step to start if there's a persistent cough.
Perfect, thank you, Lynn. The next question is, my father had a lung lobectomy 2 years ago. No chemo or radiation was done. We've been doing a chest CT every 6 months for routine surveillance. Should we be doing scans or imaging of the other parts of the body, like the brain?
So what you should ask your dad, he's most likely stage 1 lung cancer after the surgery. And so for stage 1 lung cancer, the standard is still to get surveillance imaging every 6 months for the first 2 years, then after that every year, and not to do chemo or radiation or any targeted therapy for early stage 1 lung cancer. So ask him if he's stage 1, that's okay, he's getting the right treatment. Now, if he was stage 2, or even 1B, and now we're getting real technical, but a certain part of a later stage of 1, and then anything past that, yes, there are new treatments and new studies out, even since last year, that you could get some type of form of treatment. And so that's a little different. So if he is past stage 1, meaning stage 2 and beyond, yes, he should see an oncologist, and it shouldn't just be it may just be scans if he wants that, but ideally you would see an oncologist and they would talk to you about other discussion. But for stage 1 lung cancer, for all purposes, we follow with surveillance imaging only.
Thank you for the clarification.
This next one is an interesting question. Any correlation between past pneumonia or lung infections and lung cancer?
So the one that we know about, and that's why also I do think that's part of the Asian risk factor, is TB. TB, if you've had a past exposure to TB, you do have a slightly higher risk of lung cancer. In fact, but whether pneumonia itself or from RSV or influenza, we don't know that, right? Or even COVID, right? It's too early. We don't know COVID yet either, too. But we do know a history of old TB or a history of prior treated TB or that you've had TB. That is a slightly higher risk factor. Probably we don't know exactly what it is, but I will tell you that. So I can tell there's a lot of patients maybe from or family members maybe from China. So in Taiwan, they did do a study looking at men and women, Asian non-smokers in their 50 to 70 essentially, and with certain risk factors. And you either had to be Asian female, Asian male or female in that age group, 50 to 70 basically, but you had to have one risk factor. And one of those risk factors, the most important risk factor that they know that they found an increased risk of getting a lung cancer detection is if you had a family history in your maternal side of like a first degree relative. And then if you had a really significant increase in risk of lung cancer, if you had multiple people in your family with a history of lung cancer. And then the other risk factors that they use, particularly in this Asian population, is a history of TB, a history of COPD or emphysema in your lungs, and again, the family history, and then the cooking. They actually went by a cooking index because not necessarily maybe in Taiwan, but in China, there's a lot of areas that have there's a way that they can tell where you cooked and where you lived and what your ventilation system was, and if it was over a certain level, like you're in a closed little hut or whatnot, that your risk is higher. So there is a screening study going on right now that has been done in Taiwan, and that is being done for non-smokers with an additional risk factor. And TB was one of those additional risk factors. So if you have that and that, but again, that's in Taiwan, that's an experimental study. And obviously there's all mostly 99% are Asian, whereas if you know, in the United States, it's a lot harder to do. But we are trying to. So NYU, so the only study that's been done right now in the United States for Asian female non-smokers from the age of 40 to 74 is what's called the Female Asian Never Smoking Screening Study, which is done at NYU. So if you live in the New York area right now, they've screened 201 women randomly, doesn't matter risk factor at all, and they screen you with a CT scan and they follow you. And they're also doing an experimental blood test. So that's what's next on the market, right? Is a blood test. If we could do a blood test without doing a CT scan and test us all and just know if we had early lung cancer, that would be great. And that's what that trial is testing in a higher risk population, which is Asian female non-smokers. And they did find preliminarily, they did find 3 patients out of 200 that were screened, they did pick up lung cancer. And they were all EGFR positive and they were all treated with surgery and they're all on targeted therapy. So there is a big push to do that, to make it other than just the NYU study. We're trying to push that out further and not, you know, this is a plug for California, right? California has the highest amount of Asians out of our 40 million people. So really what we want to do is we want to bring that study here because for all you, that would be perfect, right? Yeah, we have more Asians in here than New York, although New York has a high amount of Asians, but California has even higher. So we're really interested in doing is bringing that technology to get the blood test and or CT scan for our Asian females here, which hopefully we can do.
And a related question to that, someone wrote, I participated in FANS and found there is not a mental health, stress, emotional aspect of the questionnaire. Asian women may experience a different level of stress that may increase risk of having cancer in general. What are your thoughts about this?
Yeah, I saw that. I was ready to answer that. So yeah, yes, you're right. That the behavioral part, I think, is a factor. The stress part, I think, is a factor. But the way we're trying to catch that on the fan survey is where were you born, right? And where do you live now, right? That's all your demographic data is on there. So our smarter people than I will, our analysts will analyze that and look at that. If there's a trend towards more women from certain parts of China that moved over versus with a higher risk, that we're going to take that kind of does take into account a little, a little bit more. So hopefully you're right. It's not a direct question for mental health. And I definitely think that's a factor, just in my own personal bias. But also when you're filling out your mental history or psychiatric history or medical history, if you have severe anxiety and you're on medications, right? When you fill out your medication list, we'll flag that, right? If you're on Xanax and multiple antidepressants, that may be an indirect correlative. And yes, so we're hoping to pick it up that way. So hopefully that'll help, pick up part of it indirectly.
Thank you.
Okay, everyone, we're getting close to the end. So we have time for the last 2 questions, and then we can move on to a last thought from our speakers. So let me get to the second to last question. So I have one here. I participated in FANS and
I
found...
went through that.
Oh, you went there. Thank you. Thank you so much. So next one, is the standard chest X-ray helpful in finding early lung cancer?
So the short answer is for the lung cancer screening study that showed a reduction in mortality and picking up more lung cancer, it was comparing chest X-ray to CT scan. So chest X-ray, bottom line is, if you're looking at a high risk lung cancer screening group, it's not beneficial. The control group, meaning the basic, is getting an X-ray every year versus getting a CT scan. And the lung cancer screening, all the 2 studies that showed a benefit in mortality and reduction in mortality and picking up more lung cancer and picking it up early, it's based off of a CT scan. So that's why when we talk about lung cancer screening, to reemphasize, it's a CT scan. The X-ray getting what I'm talking, so the X-ray is not going to be helpful for that. It's been shown, we know that. But what an X-ray can be helpful is if you're a non-smoker or you don't fit the high-risk lung cancer screening criteria that Medicare and that the insurance pays for, that Kaiser and every other hospital system covers, and you have a cough and it's not getting better and it's 4 weeks and it's still longer, you don't want to wait 6 months. What Dr. Lay and I are saying, at least get some type of imaging study. And if you're getting drawback from a primary care doctor, which I can understand that, for a CT scan for just, because you're Asian and female, then, but starting with an X-ray can still sometimes show something that could be a major issue. So at least that's easier to get. You can get that quickly. You don't have to get an appointment. We all know that they put the order in. You can go to any Kaiser and you just walk in, right? That's at least at Kaiser. And I think that's that way at Sutter and everything. So that's kind of what we mean by X-ray. But don't think that X-ray is a screening study. The screening study is a CT scan, not an X-ray.
And to add on to that, if you had symptoms, then, and if the X-ray gets done and there's nothing to worry about, but your symptoms persist, that's an argument to get the CT.
CT.
And a very last question. For Asian female non-smokers who have had surgeries for ovarian and or breast cancer, should they be screened? I think Dr. Lei, you were mentioning something about this earlier.
Yeah,
Yes.
I think Dr. Villado might know this
Dr.
better.
Yeah, there is an increased risk with in studies, in database studies. If you have a personal history of breast cancer and or family history of breast cancer, ovarian cancer in the family, that is considered, and being Asian female or women, or just woman in general, not necessarily Asian, you do have a slightly higher, there has been shown a higher risk of you yourself getting a lung cancer after personally being diagnosed with breast cancer. And that has been shown in large kind of database studies. But yes, that is my interest. You heard me say that earlier. That is my interest right now, is to say that I do think we're going to see a higher risk when we look at our patient population. And that's certainly what I see clinically. When I do the history and it's, a new woman with lung cancer, certainly when you go over, oh yeah, actually, and I had my lumpectomy, I had breast cancer surgery and radiation 20, 30 years ago. We're seeing that more and more. We've seen that in other databases, but I think what we're seeing here in California, I do think there's going to be a higher risk profile with that.
And I can add that in that should I screen program, that is one of the questions that is asked. Did you have any other kind of cancer? And so you could, again, put your information in there and then play with the numbers and say, no, I've never had any other cancer. And then do the exact same data, answering all the questions, all the 9 questions except this one, and change it and say, yes, I have. And it'll give you the difference in percentages. So that if you have that question legitimately, you can just type it in and play with the numbers.
Perfect. Thank you.
Okay, thank you to our speakers. Fortunately, I believe that's all the time we have tonight. And thank you to our audience for all your wonderful questions. Before we end this call, I would like all of our speakers to share one takeaway message for our audience. I will go first. So an important point that I want our listeners to take away is that even non-smokers can develop lung cancer. How about you, Cumin?
I want everyone to know that it's really important to follow up with your primary care doctor for lingering symptoms, especially a cough.
Okay, thank you.
I wanted to say something kind of similar, but the idea was that, yes, if you have symptoms and we've talked about this difficulty with getting a CT scan if you don't have, you don't fit the screening criteria. If you have persistent symptoms, then go to your doctor. And if your doctor is not, is not willing to do it, you can always talk to me. Okay, you can always come talk to your pulmonary doctor, and it's not unreasonable, because we have a lot of patients who want to talk with someone who has a little bit more information or experience with lung cancer screening specifically.
And then lastly, yeah, the main thing to reiterate is for lung cancer screening, the screening test for lung health, whatever you want to call it, lung cancer screening, lung health, it's a CT scan. It's a low-dose CT scan. It's not the X-ray. And not only do you have to get it, once you get it once, that's great. And you'll be in our program. And whether you're a Kaiser member or not a Kaiser member, most likely, most places have a program. So we'll follow you after that. But the key is you have to come back again. We see a lot, the 60% of the benefit is not just the first scan. A lot of times, like Dr. Lei had mentioned, you're not going to catch it on the first scan. It's every scan after that. So it's just like a mammogram. It's just like a physical health exam. It's just like getting labs every week, every year. You have to get the CT scan every year for the benefit too. So first you have to come in, get the CT scan if you qualify, and then you have to get it every year after that. So it's like a routine check. So it should be part of your routine health maintenance check. And so that's kind of, for lung cancer screening for that at-risk population. If you can remember that, I think that'd be good.
Perfect. Thank you. So we once again want to acknowledge our wonderful Dr. Tran, who could not be with us tonight. She also was an integral part in making this House Calls event a success. So again, we'd like to invite you to complete the survey with the QR code on the screen and with a link in the chat. Thank you, everyone, and good night.